That the law is and will cost us jobs and stall economic growth. I know you don't think that's true.
Nonsense.
I don't think it's true, but
Nonsense.
tell us why.
Nonsense. Look, the basic purpose of the Affordable Care Act is to make sure that every American has the opportunity for affordable, quality health care. I don't know how anybody can dispute that goal. What the President has always said is the Affordable Care Act is not perfect. If people have good ideas for how we can improve it, bring them forward. But don't just tell us what you're against. Tell us what you're for. And I don't know how anybody can't be for that. We have had over 3 million people sign up in the marketplaces, and we still have until March 31st, and we could use the help of everybody in this room to market the Affordable Care Act. A recent survey showed that half of the uninsured are in about a little over 150 counties around the country, and so we're targeting our efforts and working with mayors across the country to try to market the Affordable Care Act and get people informed about what their opportunities would be. My experience chairing the board of the University of Chicago Medical Center taught me that far too many people still use the emergency room as their primary care physician. That's not providing good quality. As great as the university is on the forefront of medicine, the emergency room is not designed to be primary care. And just think of all the people who wait until their symptoms are acute before they go to the hospital. And I know President Preckwinkle knows this from Cook County Hospital. We want to get folks into those primary care, get used to going to a primary care physician so that you have preventive opportunities and avoid those diseases that can become so acute. Already so many people are benefiting from the Affordable Care Act. And whether they're the folks who signed up before January 1st, we had a story of a woman who January 2nd was in acute pain, calls the hospital, finds out that she can get authorization for an important treatment and is being treated. And without it, she would have been in bankruptcy. And those stories are happening all across the country, not to mention the people who already had insurance. And keep in mind, the vast majority of Americans have health insurance, but it's going to be strengthened under the Affordable Care Act. And so for people with pre-existing conditions who had no job mobility before because they were stuck with that insurance and fear of losing it if they changed jobs, now you can change jobs. You can start your own business. You can have enormous flexibility that wasn't afforded to you before. Women who oftentimes you put yourself last because we know we take care of your children, you take care of your spouses, you take care of your parents, and if it means you sacrificing and not going in for your very important regular checkups, you do. And now you can do it without any kind of a copay. And so it's everything from wellness checkups to contraception. And that's a very important benefit of the Affordable Care Act. You can no longer get dropped if you have a pre-existing condition, but you also aren't going to hit lifetime or annual caps. What often happens is just when you need the insurance most, your insurance company says, nope, that's it, you're done. They can't do that anymore. And so part of what we have to do is a better job of telling the story about the benefits of the Affordable Care Act. And that's where, again, everybody in this room comes in. The only way that people are going to really understand what's in it is if they know what's in it, and they're going to hear it from people that they trust. And so who better than folks around the country at the water cooler, at the kitchen table. We have a big push now with moms because we think that the young women are going to sign up. You know, the young men, not so much. You know what I'm talking about. And so, but if your mom or your girlfriend says, come on, why don't you sign up? Don't think that you're invincible because you've never been sick. Bad things happen to good people all the time. And so it's well worth that insurance. And it is available and it's affordable and everyone in this country should have it. So I think that history will prove how important this is. There hasn't been a major initiative such as the Affordable Care Act that has been put in place that hasn't had some bumps along the way. But I believe that just as we look back on Social Security and Medicare as anchors of our social safety net, so too will we view the Affordable Care Act.